Hi, and welcome back to Spine and Rehab Specialists. I'm Earl Hayden, one of the physical therapists here, joined again by Chris McMillen. So today we're going to show you 5 different things you can do if you just had a cervical fusion. So, one of the first things we have to be careful with after we've had a cervical fusion is we can't do any active motions of the neck. So you can't move your head really. Alright, so you're like Michael Keaton in the old Batman movie. Alright, so what Chris has to learn how to do is move around without moving his head. So this is where good skills like log rolling comes into play. All right, so I'm gonna bring a pillow over here. So right now, Chris is stuck looking straight ahead. You can't look over, you have to be surprised. All right, and now we're gonna lean back down. Normally he would have a brace on, okay? So just something to keep everything nice and straight. So we wanna learn how to roll, okay? So the way we're gonna do this, we wanna roll over to the left side. So Chris is gonna bend his right knee, and then he can bring this arm over here, and then all in one unit, he's gonna reach over with this arm and reach over with the other leg, just kind of turning everything. All right, now normally this would be done on your bed. You wouldn't be trying to play like junior cliffhanger like this and try not to fall off the table. But that's the main thing. You want to be able to move around without moving that head. And you can practice this going from side to side, moving around. After the surgery, this might feel like a workout. So just get a few repetitions in, maybe 5 to each side, practice this throughout the day. So the next thing we can do is, again, for a bed, you can't do any active motions for your head and the neck. So depending on your surgeon or which surgical protocol your therapist is following, you probably can't do any active motions until up to like 12 weeks because all that stuff is still settling in there. You don't want to mess up all that hard work your surgeon did. But we can do passive stretching of the neck. So to do that, let's go ahead and lay down again, Chris. There we go. So your therapist or someone who's your therapist has taught, and maybe like a family member, they can help with a little bit of the stretching at home. We can use some passive stretching. So passive stretching means someone else is doing all the work for you. So here we go. I'm turning Chris's head, and I'm being very gentle with this. You notice I'm not lifting his head up or anything. I'm just working on some gentle turning motions. We can even go side to side, working on that. One of the motions they want us to avoid at the very beginning as well is no extension. So nothing going back. We can't even do retractions, which is something we normally like to do. But at the beginning, we really have to avoid that again to probably after like 12 weeks or so. So maybe doing little brief holds or longer holds if you really want to try to loosen up these muscles. Anywhere between 10 to 20 seconds should be good. So one thing we can definitely work on, even though we can't really move around the head or do a lot of resistance with the arms because we don't want to disrupt that, we work on some gentle core work, learning how to engage all these muscles here. So again, Chris, go ahead and lay down. So we're going to do some T activation or transverse abdominis activation. We're going to use the Swiss ball. So we're placing this right here. His hands are going to go on top of the ball, and then he's going to take a deep breath in and then blow out through his mouth like he's trying to blow out a candle. As he does that, he's pushing into the ball and just kind of tightening around here. Now done properly, you should feel these muscles kind of tighten around. If you're having some difficulty with that, or this is pretty easy, you want to start getting a little bit more work, you can combine this with a little knee raise. So as we're pushing down with the arms, we're lifting up with one knee, just crushing that ball as we squeeze, creating that pressure. Okay, so it doesn't take much for this. 5 to 10 second holds, anywhere between, 10 to 20 repetitions should be good. You maybe do this like twice a day. So now, let's say you've done all that, some more time has passed on. Let's say maybe we're about like 6 weeks after you've had the surgery. Now you can start throwing in some very gentle exercises to start building up the strength in the arms, okay? So we're gonna start with some rowing, but we're using some TheraBand here. Again, we're limited to 5 pounds, so we can't do a lot of resistance yet. You're not gonna be a power lifter, okay, at the very beginning. So very light resistance we can work on. Rowing, so learning how to move these shoulder blades around. So we build this up. This is going to do different things. One, we're trying to build up the strength in the hands again, working on that grip strength, okay? And then we're learning how to move the shoulder blades around, so we're able to gradually work on reaching up. So you want to keep the repetitions high, especially with such a light resistance. So you can do high reps anywhere between 15, 30 or even up to 30 repetitions. That's too easy. You do longer holds, okay? And now we're starting with the row because this is not really stressful. Outside of like trying to do maybe like a backwards fly, I would save a movement like that until later on. So rowing is good, working on gripping is good. Again, just nothing more than 5 pounds for at least like the first 6 weeks or so. One of the other most important things we want to keep in mind is after these surgeries is the importance of keeping up your cardiovascular conditioning. So cardio is super important after any type of surgery because the better your heart is working, more circulation you have, and the quicker your body's going to help recover. So you have different options for this. Here we're using a recumbent bike. Okay, so nothing wrong with this. There really aren't a lot of limitations on this. You can go for anywhere between 8, 20, 30 minutes. You can put a little bit more resistance on it if you want, as long as it's not causing any pain. Other options you have are using the arm bike over here. So just going around forwards and backwards. At the very beginning, you probably can't put a lot of resistance on there. Actually, according to some surgical protocols, you don't want any resistance. So you're just going through the movements. But again, after about 6 weeks or even like maybe at the 8 to 10 week mark, you can start putting some more resistance on there and just working on that and building up the strength. Of course, one option that we have here at Spine and Rehab Specialists is our awesome Ultra G treadmill. So this one over here, again, we can use this to just work on walking. Probably won't do any running because you want to prevent any stress, but you can decrease the amount of weight and pressure you have on your joints and help you just build up that confidence and walk around, because sometimes after this type of surgery, maybe you don't feel the most steady, maybe you feel a little dizziness, and you just want to slowly get back and swing things. This is one good way to build that confidence back up before you get out there and start walking around in the neighborhood. All right, and those are 5 different options that for different types of exercises you can do after you just had a cervical fusion. So if you have any more questions on that, please make sure to join us tomorrow, where two of our other therapists, Harry Coster and Anthony Durant, are going to go over more of this surgery and what is done, why it has to be performed, and more, and give you all more information on how we can help you out with that type of procedure here at Spine and Rehab Specialists.